Chapter 7 Adrenergic Drug Sympathomimetics. Chapter 7 Adrenergic Drug Sympathomimetics. Adrenergic drug sympathomimetics. These are drugs which mimic the effect of sympathetic stimulation or those of catecholamines. Their effects are due to stimulation of adrenergic receptor directly or indirectly on the effector cell, hence also called as adrenergic drug. Classification. Classification based on chemical structure, catecholamines, epinephrine, norepinephrine, dopamine, and isoproterenol. Norcatecholamines, phenylephrine, ephedrine, amphetamine, tyramine, etc. Classification based on mechanism of action. Direct acting agent. They act directly as agonists on alpha and or beta adrenergic receptors. Example: epinephrine, isoproterenol. Indirect acting agent. They act on adrenergic neuron to release noradrenaline, which then act on the adrenergic receptor. Example: tyramine. Mixed acting agent. They act directly as well as indirectly. Example: ephedrine. Adrenergic drug: direct acting, indirect acting, mixed acting. Direct acting: alpha agonist or beta agonist. Alpha agonist, non-selective epinephrine, norepinephrine, selective alpha agonist, phenylephrine, alpha agonist, clonidine, detomidine, metilomidine. Beta agonist, non-selective isoproterenol, epinephrine, selective beta 1 agonist, dobutamine, beta 2 agonist, terbutaline, salbutamol, albuterol, clenbuterol. Indirect acting: tyramine, amphetamine. Mixed acting: ephedrine. Pharmacological effect of adrenergic drug. Pharmacological effect of adrenergic drug. Heart. Alpha 1 and beta 1. Increase in heart rate, positive chronotropic effect, and increase in force of cardiac contraction, positive inotropic effect. Blood vessels, mainly alpha 1 but also beta 2. Both vasoconstriction alpha 1 mediated and vasodilation beta 2 mediated can occur depending on the drug, its dose and vascular bed. There is dilation of blood vessels in skeletal muscle, lung, and mesentery beta 2 action. Delayed reversal phenomena of epinephrine reversal. Delayed reversal phenomena or epinephrine reversal. Blood vessels contain both alpha and beta 2 receptors. Alpha receptors are more abundant, whereas beta 2 receptors are less but more powerful and sensitive. Epinephrine cause increase, which is followed by decrease in blood pressure. The rise in blood pressure is maintained by alpha receptors, which are more in number. Though beta 2 receptors are also occupied by epinephrine, their effect is suppressed by activation of large number of alpha receptors. As the concentration of epinephrine decreases by metabolism or elimination, it's dissociated first from the less sensitive alpha receptor. So, at later stage, the number of activated beta 2 receptors remain more than the activated alpha receptors, which cause decrease in blood pressure. Now, the presence of alpha receptors blockers like ergot etc. renders alpha receptors inactive and inhibit the rising phase of epinephrine-induced blood pressure. But beta 2 receptor mediated action, example fall in blood pressure, predominates even at higher concentration of epinephrine, as their suppressor alpha receptors are blocked. As the effect of epinephrine is reversed by the presence of alpha receptor blockers, and the phenomena was first observed by Dale The phenomena is called as delayed reversal phenomena. Respiratory tract beta 2. Respiratory tract beta 2. Inhibitory effect on smooth muscle of respiratory passage, causing relaxation of bronchi and trachea. Epinephrine and isoproterenol, but non-epinephrine are potent bronchodilators. Gastrointestinal tract, both alpha 1 and beta 2. Inhibitory effect on smooth muscle of GI tract, causing decrease in tone and motility. Alpha 1 mydriasis due to concentration of radial muscles, decrease intraocular pressure by enhancing both conventional via a beta 2 receptor mechanism and UV scleral outflow, perhaps via prostaglandin produced from the eye. Sex organ alpha 1 ejaculation of male sex organ, metabolic effect like hyperglycemia alpha 1 and beta 2 due to glycogenolysis and hyperlipemia beta 3 due to lipolysis. Splenic capsule contracts alpha and more RBC are poured into circulation. CNS stimulation causing respiratory stimulation, weakness, fullness, increase in psychomotor activity and an erotic effect. Sympathomimetic agent and their clinical usage. Sympathomimetic agent and their clinical usage. Adrenaline, epinephrine, and noradrenaline, norepinephrine. Classically, these agents have been used to reverse hypertension, hence the group name presoraminis. Noradrenaline is best used by continuous IV infusion 8 microgram per ml, 2 ml per minute. It causes generalized vasoconstriction with increased peripheral resistance and increased systolic and diastolic blood pressure. Adrenaline, myocardial stimulation induced by adrenaline is often accompanied by disordered rhythm of the heart escape under trichloroethylene, chloroform, cyclopropane or halogen anesthesia. For this reason, adrenaline is not given intravenously. Subcutaneously injected adrenal is still used to relieve the severe hypotension and bronchoconstriction of acute hypersensitivity reaction used with local anesthetics. Epinephrine and norepinephrine potentiate local anesthetic action by decreasing absorption of local anesthetics as local hemostatics by applying epinephrine moistened gauzes or sponge 1 leg to 1.2 leg dilution over the bleeding surface mucosa or subcutaneous tissue, arrested bleeding due to local vasoconstriction. In allergic or anaphylactic reaction and acute bronchial asthma, epinephrine reversed the acute hypotension and dilated the respiratory passage. Kettle enforced 4 to 8 ml of 1 to 100 dilution IM or SC. Sipenswai 1 to 3 ml 100 to 1000 dilution IM or SC. Dog and cat 1 to 5 ml 1 is equal to 1000 10,000 dilution IM or SC. As cardiac stimulants used in the treatment of acute cardiac arrest, AV block. Ephedrine. It is naturally acting alkaloid obtained from Ephedra vulgaris. Mixed acting mainly act indirectly but also has some direct action on alpha and beta receptor also. It is resistant to MAO and COMT. It is 100 times less potent than adrenaline but longer lasting 4 to 6 hours. It was the first agent to be used clinically in management of asthma. The drug was previously used as bronchodilator, vasoconstriction, a heart stimulant, a mydriatic, and a CNS stimulant. Nowadays, for most of these purposes, there are preferred drugs which are pharmacological cleaner, more potent alternative. Amphetamine, CNS stimulant, It is a synthetic, orally active, largely indirect acting alpha and beta agonist, have euphoriant and habit-forming properties in men. It has been used by athletes and given to race horses to improve performance. Illegally doping. The central effect of amphetamine include alertness, increased concentration and attention span, euphoria, talkativeness, and increased work capacity. Fatigue is allayed, hence athlete performance is improved temporarily, followed by deterioration. Phenylephrine. Phenylephrine vasoconstrictor. Phenylephrine vasoconstrictor. It is an alpha 1 agonist, less potent but more long lasting than noradrenaline. It is used in hypotension, in local anesthetic formulation, in decongestant, and in ophthalmology as 10% solution when pupillary dilation without loss of accommodation is required. Isoprenaline, isoproterenol, bronchodilation and cardiostimulant. It is a synthetic mixed beta agonist. The drug is resistant to MAO but metabolized by COMT. Bronchodilator beta 2 action to asthma in men. Powerful cardiostimulatory action beta 1 to accelerated ventricular rate in heart block. Salbutamol, albuterol, bronchodilator. It is a selective beta 2 agonist. Example, acting on bronchodilator muscles, vasculature and the uterus. Beta 2 selectively is only relative. Salbutamol has beta 2 is equal to beta 1 action ratio of 10. The drug is lacking the undesirable cardio excitation side effect of isoprenaline in asthmatic. The drug is resistant to MAO and COMT and is having longer duration of acting as compared to isoprenaline. It is used as inhaler by asthmatic. Inhaled salbutamol produces bronchodilation within 5 minutes and the action lasts for 2 to 4 hours. Terbutaline bronchodilator. It is similar to salbutamol in properties and use. Inhaled salbutamol and terbutaline are currently the most popular drug. Isojuprine, tocolytic or uterine relaxant, selective beta 2 agonist, depresses smooth muscle contraction in gravid uterus, so useful in threatened absorption. Clenbuterol, selective beta 2 agonist. It is having tocolytic and bronchodilator action. Chapter complete. Thank you.